Good afternoon. Thank you for joining me today. My name is Tim Pawlik. I am the chair of the Department of Surgery here at the Ohio State Wexner Medical Center, and also the surgeon in chief. This past Tuesday, I posted a video to Facebook describing some of the implementation around phase one of recovery for Ohio. As you likely know, Governor DeWine announced roughly a week ago the initiation of phase one recovery as it pertains to hospitals here in Ohio. Phase one recovery as it relates to surgical procedures and other invasive procedures involves the ability for places like Ohio State Wexner Medical Center to now offer to our patients the ability to have their ambulatory or outpatient surgery or procedures performed. So those operations or those procedures that do not require an overnight stay are now permitted in the state of Ohio. This is because through the measures that were taken by Governor DeWine and Dr. Acton, we have flattened the curve here in Ohio, and we have enough personal protective equipment and have taken the necessary steps here at our hospital to protect our patients and our providers and our staff, such that we can offer these surgical procedures to our patients. So our hospitals have always been open for those patients who have any essential medical needs that require surgical attention. Our hospitals can always provide those services to patients. So anything that requires surgical services or an invasive procedure that may represent a threat to life, limb, disease progression, organ sustainability, severe symptoms, or severely impacting your quality of life. Those procedures, both surgical and non-surgical, continue to be performed. What phase one allows us to now do is for those procedures and operations that were less essential or non-essential but require no overnight stay, we can now provide those services. So based on my conversation and post from Tuesday, I've had a number of questions that have come through, and I'd like to address some of those questions. One question is, when will the hospital reopen for surgeries that require an overnight stay? And so, as I mentioned, the hospital is open right now for surgeries that require an overnight stay, as long as they meet the criteria of being essential. And again, essential means that having the surgery is necessary because the condition may threaten your life, limb, organ, risk of progression of your disease, or severe symptoms or quality of life. The hospital has always been open to do overnight surgeries as they pertain to any of those essential indications. When hospitals will reopen overnight for non-essential procedures and surgeries is still a little bit to be defined. Right now, we are in phase one, which is ambulatory surgeries that require no overnight stay. And we anticipate that we will be rolling into this as we currently are over the next 1 to 2 to 3 weeks. And then we await Governor DeWine's and Dr. Acton's assessment of the situation in the state with regards to our personal protective equipment status, as well as the number of cases of COVID-19. And depending on those factors and perhaps others, then a determination will be made when we will be moving into phase two of the recovery, which would involve the ability to do non-essential surgeries that require an overnight stay. It's hard to exactly predict when that may occur. It may be as early as the end of May or the beginning of June. But again, this will be something that will be continually reassessed over the upcoming weeks as we move into phase one and see how we are able to handle that. Another question that was sent was, what additional things should I be doing to prepare for my surgery during this time? Well, I think in general, just making sure that you're taking care of yourself, continuing to try to live a healthy lifestyle. If you smoke, then you should try to at least cut down or stop smoking in preparation for your surgery. You should try to be maintaining a healthy diet and maintaining your nutritional status. And then in addition, if you're anticipating a surgery, it would be best that if you try to quarantine yourself at home, really maintain all of the rules and regulations around social distancing, decrease your your interaction with others, because you want to decrease as much as possible any potential exposure to COVID-19, so that you would not be at risk for contracting the virus, obviously, if you are anticipating a surgery in the upcoming days or weeks. One thing that we have changed with regards to patients who are undergoing operations or procedures is that patients will be undergoing preoperative testing for COVID-19 prior to their surgery. This will typically occur anywhere between 3 to 5 days before your operation is scheduled, so we have ample time for the test results to be back. This is helpful, and it allows us to assess your COVID-19 status, the plan with you as the patient, whether if indeed you were COVID-19 positive, if we should proceed with the operation. If you are indeed COVID-19 positive, it does not mean that your operation would necessarily be canceled. Every case is taken on an individual circumstance, and everything is discussed between you and your provider to make the best decision for you and your health. However, if the procedure was going to proceed and you were indeed COVID-19 positive, then we would have the opportunity to take the additional necessary precautions with regards to where you would be treated in the hospital, and be able to better protect you, other patients, and our staff. That segues into the next question that I received, which is, what precautions is the medical center taking to ensure patient safety? And you can rest assured that the Ohio State Wexner Medical Center and the James Cancer Hospital are very safe. There have been extensive measures that have been taken by our medical center to ensure the safety of our patients and our staff. These include limiting and severely restricting the visitors in the hospital to decrease the number of people and person flow throughout the institution. We've also implemented screening of all employees, faculty, and staff at home using a web-based app that screen for any potential symptoms, as well as daily temperature checks of any individual that is entering our medical center, so that we can aggressively screen for anyone who may have signs or symptoms of COVID-19. In addition, upon entering our medical center, patients, staff, and faculty are all given a face mask, and face masks are worn at all times throughout the institution when there is person-to-person contact. In addition, the James Cancer Hospital is a COVID-19 free zone. Given the special needs that cancer patients can frequently have, given their sometimes immune compromised status due to the fact that they have cancer or maybe receiving therapy such as chemotherapy, which can suppress your immune system, we have elected not to have any patient who has COVID-19 in the James Hospital. So those patients who are getting treated for cancer can rest assured that they're in a safe environment with minimal to no exposure. And even in other parts of our hospital, we have gone to great extremes to make sure that patients who have COVID-19 are located in different parts of the hospital and not intermingling with other patients. We have dedicated operating rooms for patients who are COVID-19 positive that are completely different and separated from operating rooms for patients who are not positive for the virus. We also have an adequate supply of personal protective equipment for all of our faculty and staff. So we feel very confident in the safety of our medical center, and you can rest assured that your safety is our very top priority. Another question that I had is, how will I know if my surgery is being rescheduled? Well, we have a plan here at Ohio State that your provider will be reaching out to you over the course of the next 1 to 2 weeks. All patients who had their surgeries postponed have been flagged in our system, and we are currently in the process of reaching out to all of those patients, making sure that our providers' clinic schedules are populated and filled with all the patients who may be waiting for a phone call. So you can anticipate that our providers will be reaching out to you by phone, by televideo visit, telehealth visit, to talk with you, to reassess your current clinical status, to update your history and your physical, and then to talk about your individual personal situation and hear from you about whether you'd like to proceed with your surgery at this time. Would you like to postpone it for a week or two? Or do you simply want to just wait and think about it? And all of these conversations are very personal, individualized, and that's why you can rest assured that our physicians will be reaching out to you so you can have these conversations and decide if surgery is right for you at this time. In the event that you do decide that surgery is right for you in this time, we are working hard such that we can reschedule your surgery in a timely fashion that suits your needs. Another question that I had was, will follow-up or pre-op appointments be done via online appointments? During this time of self-isolation and social distancing, we have extensively utilized a telehealth platform, both telephone calls, and then also placed a very high emphasis on televideo visits over the internet through secure means. Being able to have televideo visits with our patients allows us to see you, to communicate with you, yet maintain a safe social distancing. You can anticipate that we will continue to use these telehealth and televideo platforms to facilitate your safety, and also the ease of you being able to interface with your providers from the comfort of your own home, your own office, or your own personal space. So there are some instances when we need to see you in person as providers to do a specific physical exam or to assess you in person. And so we still have that capability. Our clinics are slowly beginning to reopen. We will be reopening them in a staged fashion such that the number of patients in the clinic at any time is significantly lower than normal, such that we can maintain appropriate social distancing and, again, protect your safety as our top priority. So you can anticipate that our providers will be reaching out to you, and that this will be occurring through telephone and through televideo visits, and we will be working with you to get your surgery rescheduled. Those are all of the questions that patients sent me to us today. I'd be happy to entertain any other questions in the chat room. If you have any, there is a wealth of information that can be found at the Ohio State Wexner Medical Center website that details many of our procedures and policies related to not only the rescheduling of non-essential surgery during phase 1, but all of our different approaches that we have been taking here at the medical center to make sure that we stay focused on your health, your well-being, and we continue to work day in and day out to serve all of you within the city of Columbus, within the state of Ohio, and also throughout the nation. So with that, I would like to thank you all for joining me today. Please know that we will continue to work tirelessly to assist any and all of you. We are here for you. Please take care of yourself. Make your health a priority. We are making you a priority. We are thinking of you. We care for you. Please stay well and be safe. Thank you and have a good day.